In this video, we will discuss the methods, uses, and challenges of harnessing consumer smartphone and wearable sensors for clinical cancer research. This video's contents draw from Carissa Lowe's 2020 paper of the same name, featured in the Nature magazine. Cancer is one of the leading causes of death worldwide. In 2018, it accounted for 9.6 million deaths. It is no wonder that cancer prevention and treatment is a heavily studied topic in the bioengineering field. Not only is there an interest in the development of direct cancer treatments such as immunotherapy and research in diagnostic devices, there have also been developments in the field of patient tracking and digital biomarkers. According to the World Health Organization, about 1/3 of cancer deaths are due to the 5 leading behavioral and dietary risks: tobacco use, high body mass index, low fruit and vegetable intake, physical inactivity, and alcohol use. These are therefore preventable. As such, the tracking of these various health indicators is key to leading a lifestyle that mitigates the risk of developing cancer. Health tracking is also extremely valuable during the treatment of cancer. Digital biomarkers such as step count, heart rate, and oxygen levels aid doctors in monitoring a patient's recovery progress, as well as showing any anomalies that may indicate a need for medical care. A key challenge is getting this information in a manner that does not interfere with a patient's day-to-day life. It is difficult to ask patients to remember to report on how they're feeling every day, much less go through the trouble of getting accurate readings and measurements of factors such as heart rate, calorie intake, and steps. The development of consumer technology, especially that which we use every day, may provide a solution for this problem. These mobile sensors allow for new ways to monitor health remotely in a passive, cost-effective, and efficient manner. 2 main categories of this smart technology are wearable devices and smartphones.
As of now, there are countless devices that can be worn on the body that will track some sort of information. These are devices such as the Apple Watch, Samsung Galaxy Watch, and types of Fitbit wearables. These usually work with a smartphone in order to store and process the collected data. These devices range from counting steps to being capable of measuring skin temperature, blood oxygen concentration, or even collecting electrocardiograms. Commonly, the wearable devices help in cancer research by assessing physical activity and comparing this to the quality of life of the wearer. This can help provide a correlation between the development of cancer and physical activity. The smartwatch is better than some forms of data collection used in experiments. This is because the smartwatch is long-lasting and usually has a long battery life that can be easily recharged. It also doesn't cost too much as well, usually around the price of $100 to $500 in comparison to some expensive measuring equipment. Also, many of these devices are cloud-based, where there will be real-time uploading of data, making it easy to both record and access information. These devices are also designed to be worn at all times, which will allow for the collection of better data than some styles of measuring devices, which may need to work in a lab setting that would provide skewed information. This data, which may seem not very useful with cancer research, has shown some positive trends. In a study with patients going through systemic therapy, found that smartwatch step counts were correlated to patient-related fatigue, quality of life, depression, and performance status. These studies suggest that low or decreasing activity may lead to worsening symptoms and may be a measure of performance status. This is also seen in a study compared with patients undergoing chemoradiation therapy, where lower levels of activity measured on smart devices were associated with greater hospitalization risk, lower likelihood of completing treatment without delays, and shorter survival. A different study of advanced cancer patients also found that higher daily step counts were associated with reduced odds of hospitalization and death. Because wearable devices offer data and feedback directly to patients, these tools are also used to promote physical activity among cancer patients.
Although we've seen how wearable devices can track important data, smartphones also have sensors to collect data. Unlike wearable devices, many people in the US, about 80% of the population, already own a smartphone, which makes this device even more scalable in oncology research and data collection. The sensors in smartphones include an accelerometer, gyroscope, and magnetometer, The sensors are capable of measuring movement, smartphone use, like whether the screen is on or off, presence of Bluetooth devices, location, social interactions, and ambient light and noise. One way in which smartphone sensors are applied in oncology care is using step count, measured with the accelerometer, to gauge a patient's condition and potential complications after chemotherapy and surgery. In one pilot study, a group of patients who were aged 65 or older, diagnosed with solid tumors, and had received first-line chemotherapy were given smartphones to track daily step count. The patients would be contacted to measure chemotherapy toxicity if their step count decreased by greater than 15% from their baseline count. The study showed that monitoring step count with smartphones facilitated intervention for chemotherapy toxicity. About 60% of patients were able to have their toxicity managed via telemedicine, and the rest received urgent or hospitalized care. Another application of accelerometers is monitoring cancer patients' health after surgery. In one study with 62 patients who had went through surgical treatment, the mean amount of activity measured with the accelerometer helped distinguish between events like post-operative complications, reoperation, readmission, and emergency room visits. Another useful type of data in oncology research is location. In one study with breast cancer patients, greater time spent at home or in places with friends and family was associated with happier moods than in the hospital, which was associated with more depressed moods. Ultimately, location data, along with activity levels and heart rate levels, can all be monitored together to track for anomalies and the events these anomalies are associated with. Hopefully, healthcare teams can use this research to monitor patients and intervene and provide preventative care much quicker. For example, increasing step speed, decreased step count, less time spent at locations away from home, and increased resting heart rate were associated with emergency room visits. Finally, other potential applications of smartphone and wearable device sensing include using cameras with machine learning algorithms for diet monitoring by identifying foods and estimating portions, administering performance-based tasks like 30-second sit-to-stand tests and 6-minute walk tests, sensing biomarkers in sweat, and tracking sun exposure with ultraviolet sensors for cancer prevention.
There are several issues that must be considered when integrating mobile sensing into cancer research and care. Addressing these challenges will enable broader use of these methods and allow cancer researchers and clinicians to capitalize on mobile technology advances and maximize potential benefit to patients and families. The first set of challenges involves the collection, cleaning, and processing of mobile sensor data to make it useful to patients and providers. The biggest obstacle in this set of challenges is selecting the right device to use, because existing evidence provides only limited guidance regarding which digital biomarkers may be most valuable for specific clinical oncology populations or contexts. Translating raw data into digital biomarkers requires continuous multidisciplinary collaboration, as the volume of continuously collected sensor data can be enormous, and both clinical and technical expertise are needed to extract meaning from continuous sensor data. Some data reduction such as calculation of the daily step counts or average resting heart rate, may be handled to device software through opaque proprietary algorithms. There are, however, a number of potential clinical applications for smartphone and wearable sensors in clinical oncology. Behavioral sensor data could be useful in evaluating patients prior to treatment to obtain a more objective measure of objective performance status or frailty, and to predict likelihood of tolerating a new or aggressive therapy. Digital biomarkers previously discussed in the challenges section could also be included as a secondary measure of performance status in clinical trials, providing many more data points from which to gain insight about the effect of treatments on patient lives. If mobile sensing data is monitored in real time or used in combination with algorithms that trigger notifications to clinicians when preset thresholds are exceeded, or trajectories such as significant anomalies or changes over time, they can be used for remote monitoring of toxicities and symptoms. These symptom monitoring systems could also trigger symptom self-management interventions for patients and caregivers, or support patients in making timely decisions about when to seek care.